Have you ever actually tried to explain what inpatient rehab, IS, to like someone who's totally clueless?
Oh, I know, right?
It's tough.
Yeah.
It's like, where do you even begin trying to describe a roller coaster to someone who's never even seen a hill, you know?
Mm.
There's just so much more to it than just like checking into a facility and drying out.
Yeah, for sure.
So today, we're going to buckle up. We're
Okay.
going to dive deep, no pun intended,
Yeah.
into the world of inpatient drug rehab.
I like it.
We're going to break it down. What does it actually look like? How does it work? What alternatives are out there? Because by the end of this deep dive, you're going to have a much clearer understanding of this whole process, whether you're considering this for yourself or for maybe a loved one or someone you care about.
Yeah, it's a great topic to dive into for sure, because I think you're right. There are a lot of misconceptions around it.
Totally.
So hopefully we can unpack some of those and really kind of shed some light on what this whole journey is actually like.
Yeah, unpack, that's a good word for it. So
Yeah.
first things first, inpatient. What does that even mean in the context of rehab? Like, help us understand that term.
Yeah, so inpatient really just means that you're going to be residing at the facility for the duration of your treatment.
Oh, yeah.
So it's about this full immersion into a very structured, very supportive environment
Okay.
that's specifically designed to help you focus on recovery.
So it's not just about getting away from your everyday life. It's like almost being immersed in something else entirely.
Exactly. And a big part of that immersion is removing yourself from kind of the people, places, and things that might be triggering for your addiction. Think of it this way. If you have like a cat allergy,
Sure.
you're not going to spend your vacation in a cattery.
No, you're going to get away from cats.
You're going to go somewhere you can actually breathe.
Right.
So inpatient rehab, similar. It's like by removing those external triggers, you're actually giving yourself the best chance to really heal and focus on the internal work that recovery requires.
I love that analogy
Mm-hmm.
because it makes it very clear, right? You're not just trying to white knuckle it through this. You're actually going somewhere that's going to support you in a very specific way.
Exactly.
Okay, so let's say you've made that decision. You're going to enter an inpatient program. What can you actually expect on a day-to-day basis? Like, what's the schedule? What's the vibe?
Yeah, so every facility is going to have its own like rhythm and its own approach for sure, but there are some common threads that you'll typically find in kind of most inpatient rehab programs.
Okay.
Your day is usually pretty structured, and it's often structured around a variety of therapies.
Yeah.
And that can include both individual therapy as well as group therapy.
Okay, hold on. I have a question about that. Why both? What's the thinking there?
Yeah, that's a great question. They really serve distinct but complementary purposes. So in individual therapy, you're really working one-on-one with a licensed therapist, and you're really digging deep into your personal story, like underlying causes of your addiction, past traumas you might have experienced.
Really developing coping mechanisms that are specifically tailored to your own individual needs.
So that makes sense, right? Because everyone's story is a little bit different, so it would make sense that you would need some of that individualized attention.
Exactly.
Okay, so that's individual. What about group then?
Yeah, so group therapy is where I think the magic of shared experience really comes in.
Okay.
And, you know, it might sound a little intimidating at first, maybe a little awkward, but the truth is, sitting in a room with others who truly understand what you're going through
Yeah.
can be incredibly healing. In fact, I once worked with this patient who he struggled with addiction for years, and he always resisted group therapy.
Really?
He was so resistant to it.
Interesting.
Just thought it would be pointless, awkward, you know, just wasn't really open to it. But he finally decided to give it a shot.
And I remember in one of his first sessions, he just broke down crying because he finally felt seen and heard
Wow.
for the first time maybe in his life. And he realized he wasn't alone.
Wow.
And I think that was a huge turning point in his recovery.
That is so powerful. And I can see how, you know, intellectually group therapy makes sense, but to hear you tell a story about a real person who experienced that just adds like another level to it.
It makes it really real.
Yeah.
It does. And it reduces shame.
Okay.
It fosters this sense of community and belonging, which is so important in recovery.
Right, because I would imagine addiction can be very isolating.
Absolutely. And it allows you to learn from each other's successes and challenges.
Oh, okay. So it's like this, I don't want to say feedback loop because it sounds too clinical, but it's almost like this reciprocal learning process where you're like all kind of like teaching and supporting each other along the way.
It is. It's like a support system built right into the program.
I love that. Okay, so we've talked about therapy, individual, group. What else? Is that it? Is that all you're doing all day long?
That's a big part of it. But there's also, you know, Typical schedule will often include things like educational workshops, maybe some recreational activities.
Okay.
And then for many, that kind of sometimes daunting but very, very important first step, which is detoxification, or what we call detox.
Detox. Yeah, that's the part I think a lot of people, when they think about rehab, that's what comes to mind. It's like, oh, detox. It's
Yeah.
going to be terrible. So break that down for us. What does that actually look like? Especially because I know there are certain substances that have like way more intense withdrawal symptoms than others. So how does that all work?
You're exactly right. So detox is really all about kind of safely and comfortably ridding your body of that addictive substance. Now, for some substances, this might be able to be managed with minimal discomfort, but for others, like alcohol, opioids, benzodiazepines withdrawal, can be really, really rough.
Yeah.
And in some cases, it can even be dangerous if it's not managed properly.
And that's why it's so important to go through this process in a medically supervised setting, right?
Absolutely. So during detox, you're going to have a team of medical professionals who are monitoring your vital signs. They're there 24/7. They can provide medication to help manage those withdrawal symptoms, really just ensuring your safety and comfort throughout that whole process. So it's about getting you through that initial hurdle as safely and comfortably as possible.
It's like having a safety net while you're going through, I would imagine, probably one of the tougher parts of recovery, right? Because your body's going through it, your mind's going through
Yeah,
it.
absolutely. It can be really intense.
Okay, so you've got that medical support, you've got the therapy. You mentioned something about educational workshops. What are those all about? Why are those valuable?
Yeah, those are designed to really empower you with knowledge about addiction, about recovery. They cover a wide range of topics, understanding how addiction actually works, like the science behind it, how it affects your brain, your body. You might learn about relapse prevention strategies, coping mechanisms, even practical life skills that you might need to work on.
Oh, interesting. So it's like almost holistic in a way, right?
Exactly.
It's not just about breaking free from the substance itself. It's like, how do you rebuild your life after you've gone through this?
Yes, it's equipping you with those tools to thrive in recovery long after you've actually left that facility.
I love that. It's such a good point. Okay, so we've talked about the medical support, the therapy, these educational components. Is there anything else we're missing? Or is
Yep.
that pretty much the gist of it?
Well, one more thing I'd add that's really important is medication-assisted treatment, or EMAT, as we call it.
Okay, MAT. Tell me more about that. Is that medication to help manage cravings?
Exactly. So it can be incredibly helpful, especially for kind of supporting long-term recovery. It's using medications like methadone, buprenorphine, naltrexone. These are FDA-approved medications.
Okay.
And they're used in combination with counseling, behavioral therapies to really help people manage their addiction over the long haul.
Okay. And how do they work? What are they actually doing?
So they work in different ways, but essentially they can help reduce cravings,
Oh, okay.
block the euphoric effects of certain substances, particularly opioids,
Got it.
making it easier for you to actually focus on the therapy and rebuilding your life without that constant pull of addiction kind of.
Nagging at you
Exactly.
in the background. Got
Yeah.
it. So it's like it's like leveling the playing field a little bit so you can actually like focus on what matters.
Exactly. And it's important to note that, Maddie is not a crutch. It's not a sign of weakness. It's a tool.
It's a tool.
And it's a tool that can be incredibly effective.
And just like any tool, you want to use it appropriately.
Exactly.
Yeah. And in conjunction with other things, right?
Yes, absolutely. It's not a standalone solution, typically.
Right. It's all about finding that right combination, that right cocktail that works for you.
100%.
Right.
Recovery is not one size fits all.
I love that. Okay, we've covered a lot of ground here. We've talked about what inpatient rehab actually looks like, the therapy, the detox, these educational components, the medication-assisted treatment. Let's shift gears just a little bit
Okay.
and talk about, I think, the elephant in the room when it comes to inpatient rehab, which is the cost.
Yeah.
Because I think that's a big barrier for a lot of people who are considering this route to recovery. So can you talk to us a little bit about just how much this type of treatment actually costs?
It's a great point, and it's a big question, and it's a very valid concern for sure. And the truth is, the cost of inpatient rehab, it can vary like really widely depending on a bunch of factors. The location of the facility, the length of the program,
Sure.
the types of amenities they offer, whether it's a specialized program for a particular substance or co-occurring disorder. So there's not like a one-size-fits-all answer to that question.
Right. But I'm sure people are listening to this right now and they're like, okay, but give me a ballpark. Like, what are we even talking about here?
Yeah.
Because I think there's this assumption that it's just wildly expensive and only for like the ultra wealthy, which is not necessarily true.
And that's not true.
But, it's important to understand that aspect of it as well.
It is.
So let's say someone is listening and they're like, okay, this all sounds amazing, but there's no way I can afford this. What options are actually available to them? Like, where do they even begin to navigate that?
Yeah, so first and foremost, don't give up hope.
Okay.
Because there are often more options than people realize. A good first step, check with your insurance provider.
Okay.
Because a lot of health insurance plans do cover at least a portion of the cost of addiction treatment,
Oh, interesting.
including inpatient rehab.
Okay.
Now, the caveat there is that coverage can vary greatly from plan to plan.
Okay.
So it's really crucial to contact your insurance company directly, find out exactly what's covered under your specific plan,
Well, good to know.
what your deductible might look like, any out-of-pocket expenses, if there are limitations on the duration of treatment they'll cover.
Right, because I'm sure it's different if you need, 30 days versus 90 days or whatever it is. So always good to kind of get those details ironed out.
Absolutely. Knowledge is power.
Yes, it is. Especially when it comes to insurance, it feels like sometimes.
Especially with insurance.
Okay, so you've got your insurance. Are there other avenues for financial assistance beyond that? Or is that kind of it?
No, there are definitely other options. So don't hesitate to reach out to the rehab facilities themselves,
Oh,
because some of them actually offer scholarships
I'm
or
sure.
grants based on financial need.
Wow.
And they also might have flexible payment plans, like sliding scale fees based on your income.
Okay, so there's some wiggle room there potentially.
Yes, absolutely. Make it a little easier to budget for.
I love that. Okay, so you've got an insurance. You can maybe talk to the facility directly. What about like government programs or nonprofit programs? Are there any resources available through those avenues?
Yeah, definitely. So Medicaid, for example, can be
Ah.
a lifeline for those who qualify.
Right.
And then some states actually have state-funded rehab programs
Oh, interesting.
that can be a little bit more affordable than some of the private options.
Got it.
And then there are charitable organizations out there that their whole mission is to provide financial assistance for addiction treatment.
Wow, I had no idea. So there really are, it sounds like, more resources available than maybe we realize at first glance.
Often,
It's just about kind of doing that research and putting in the legwork to explore those different avenues.
Exactly. Don't be afraid to ask for help.
Yes.
And really explore every option, because there are people who want to help.
Right.
And there are organizations that are dedicated to making treatment accessible.
I love that. Okay, so we've talked about inpatient, but I want to be mindful of the fact that it's not the only path, right?
Absolutely.
Like, what if someone's listening to this and they're like, look, I can't, for whatever reason, logistically, financially, whatever, I can't do inpatient right now.
Yeah.
What are the alternatives? What else is out there?
You're so right. Inpatient is a fantastic option for many, but it's definitely not a one-size-fits-all.
Right.
Life is complicated, and sometimes that's just not possible. So fortunately, there are other paths to recovery, and outpatient programs are a really great one.
Okay.
They offer varying levels of care, a little bit more flexibility, allow you to continue living at home while you're receiving treatment.
So walk me through that.
Yeah.
So outpatient meaning you're not residing at the facility. You're, I guess, like going into the facility for your appointments.
Exactly. Like you would go to, like work or school almost.
Okay.
And these programs actually come in like different levels of intensity to kind of meet people where they're at in their own personal recovery journeys.
Oh, that's good.
So on the more intensive end, we have what's called partial hospitalization programs, or PHPs for short.
Okay, PHPs. Got it. So what's that like?
So these typically involve like 5 to 6 hours of treatment per day,
Wow.
5 to 6 days a week.
That's still a pretty significant time commitment though, right?
It is.
Okay.
It is. So it's a step down from inpatient, but it still requires you to kind of carve out a significant portion of your time.
Sure.
So to give you like a little visual, imagine yourself arriving at the facility around 9 in the morning.
Okay.
You might start your day with a group therapy session.
Okay.
Then you transition into some individual therapy.
Okay.
Maybe have a nice and nutritious lunch break where you can actually connect with other people in the program.
It's interesting that social aspect kind of woven throughout all of it.
It is. It's so important.
Because I think, going back to what we were saying before about addiction being isolating, I would imagine that that's like a key component of all of this, right? Is feeling like you're not alone.
It is, and it helps combat that shame,
Totally.
which can be a huge barrier to people actually getting help.
Right, absolutely. Okay, so you've got your group, you've got your individual, you're having lunch. What happens after lunch?
So after lunch, you might participate in an educational workshop on relapse prevention strategies,
Okay.
maybe some coping mechanisms, things like that.
Got it.
And then, you might round out your day with a mindfulness or meditation session just to kind of like de-stress before you head home.
Oh, I love that.
Yeah,
So you're still getting that like immersive therapeutic experience, but you have like your evenings, your weekends, to maybe attend to other things.
exactly. It gives you that little bit of flexibility,
Got it.
which can be really helpful for people. And then if PHP feels like a bit too much, a step down from that would be intensive outpatient programs, or IOPs.
Okay, so IOPs. Tell me about those. What do those look like?
So those typically involve around 3 hours of treatment per day,
Okay, so even less.
3 to 5 days a week. So still structured, still supportive,
Got it.
but it gives you a little bit more flexibility in your schedule.
Right, which again, if you're going to the school, if you have other obligations, that could be like a game changer.
Absolutely.
Yeah.
And then finally, we have standard outpatient programs, which are the least intensive. Those usually involve fewer hours of treatment per week.
Okay.
And those are generally best for individuals who are maybe a little further along in their recovery.
Got it. So it's almost like what's the word I'm looking for? Like a stepped care approach where you can kind of like step down in the intensity as you go.
Exactly. Yes, it's a very kind of like you can gradually transition to less intensive levels of care as you progress.
Okay, I love that because it makes it seem less overwhelming. Right.
It does.
You don't have to like jump in the deep end if you're not ready. You can kind of ease your way in.
Yes, exactly.
Love it. Okay, one thing I wanted to circle back to, because we talked about this with the inpatient, was this idea of like the group therapy component and how important that is, that sense of community. If someone is doing the outpatient route, do they still get that benefit?
Yeah.
Or is that kind of lost?
That's where support groups come in.
Oh, okay. Tell me more about that, because I feel like when people think support groups, they think like very specific things.
They do.
But I'm sure it's much broader than that.
It is. Support groups are amazing.
Okay.
And they offer that safe and encouraging space to connect with others who just get it.
Right.
They understand the ups and downs of addiction, the challenges of recovery.
Yeah.
And it's a place to share your story without judgment,
Right.
to learn from others, and just to realize, like, you are not alone in this journey.
Right. And again, that's something I would imagine that comes up a lot, is that sense of isolation and feeling like no one understands.
Absolutely.
So to have that space, whether it's inpatient or outpatient, to connect with others who are going through something similar, I think, is invaluable.
It's invaluable. And what's amazing is, there are support groups for, it feels like, just about everyone.
Really?
No matter your background, your beliefs, the specifics of your addiction,
Interesting.
there's likely a group out there for you.
What are some of the most well-known support groups out there that people might heard of?
Sure. So I think the classics that most people have heard of are Alcoholics Anonymous, which is AA,
Right, AA.
and Narcotics Anonymous, NA.
Right.
Those have been around for decades,
Oh, yeah, for a long time.
and they've helped countless individuals achieve and maintain sobriety.
Yeah, and I think the fact that they've been around for so long is a testament to how helpful they've been for people.
It is.
Right, because if it wasn't working, it wouldn't still be around.
Exactly.
Right, it would fade away.
100%.
So what is it about them that makes them so effective, do you think? Why do they work for so many people?
Well, they provide this really structured 12-step program,
Right, the 12 steps.
the 12 steps, and it kind of gives people a roadmap for recovery.
Okay, so it's like having a guidebook, almost.
It is. And a lot of people find a lot of value in the steps, in the meetings, in the sponsorship.
It's like having a guidebook and a hiking buddy all rolled into one.
Right.
With AA.
Exactly. They
Yeah.
kind of go hand in hand.
Right, which I love. Okay, so what if someone's listening to this and they're like, the 12 steps, it's just not my thing, it doesn't resonate with me. Are there other options? Or are you kind of out of luck at that point?
No, absolutely not. There are other options. And in fact, for people who maybe resonate more with a secular approach or something that's a little bit more evidence-based, Smart Recovery is a fantastic alternative.
Okay, Smart Recovery. I haven't heard of that one. Tell me more about that.
So Smart Recovery focuses on self-empowerment.
Okay.
And it utilizes a lot of cognitive behavioral techniques to help people manage their urges,
Got it.
develop healthy coping mechanisms.
Okay, so it's like giving you very concrete tools and strategies you can use
It
to
is.
like navigate those challenging moments.
Absolutely.
I love that. So it seems like from what you're saying, there's a lot of diversity in the types of support groups that are out there.
There is. It's amazing. And even beyond those kind of more well-known ones,
Yeah.
you've got groups for very specific substances.
Okay.
Groups for LGBTQ individuals, for people of different faiths, for family members who have loved ones who are struggling.
Oh, interesting. That's a good point.
So it's really incredible the variety that's out there.
Because, again, addiction doesn't discriminate.
It doesn't. And neither should recovery.
I love that.
Yeah.
And I think this is a good reminder that, like, whatever you're going through, whoever you are, there's a place for you
There is. There really is.
to get support. Now, I want to be mindful of something you said earlier, which is this idea of the cost of treatment and how that can be a barrier for people.
Right.
Is that true for support groups too? Or is that something that's usually, like, more accessible financially?
That's the amazing thing about support groups is that most of them are completely free.
Oh, wow.
They're often run by volunteers
Oh, that's wonderful.
who have been through similar experiences and want to give back.
That's beautiful.
So it's really a testament to the power of human connection.
Yeah.
And I think the belief that recovery should be accessible to all.
That's amazing. So even if someone can't afford formal treatment, they can still access this incredible resource.
Yes, absolutely.
Wow. I love that. Okay, so we've talked about inpatient, we've talked about outpatient, we've talked about support groups. It's clear there's no, like, one roadmap to recovery.
There's not.
It's really about finding what works for you.
Finding what works for you, 100%. And that's such a critical message to reiterate, is that recovery is a journey.
Yes.
It's not a destination.
I love that phrase. Recovery is a journey, not a destination.
Yep.
What does that mean to you? Like, unpack that for us a little bit.
It means that it's an ongoing process.
Okay.
With its own, twists and turns.
Right. There's going to be detours.
There are going to be good days and bad days.
Sure.
Steps forward, and then maybe the occasional stumble.
Right. You take a couple steps back.
But the important thing is that you just keep moving forward.
I love that.
One step at a time.
One day at a time, one step at a time.
That's it.
Yeah.
Yeah.
And to not be afraid of those setbacks. Right. Because I think that's a big thing is people, I've heard it said that, like, relapse is a part of recovery. And I don't know if you subscribe to that or not, but I think there is this fear that if you kind of, like, fall off the wagon, that it's over and you've failed.
Right. And that's just not true.
Yeah.
It's not. It's an opportunity to learn and grow.
Exactly. It's like, okay, what can we learn from this? What happened? How can we do things differently next time?
Absolutely. It's part of the process.
Yes.
It doesn't mean that you failed.
Love it. And I love that we're ending on this message of hope, right? Because I think that's what it's all about, is that no matter where you are in your journey, there's always, like, that light at the end of the tunnel.
There is.
You just got to keep moving towards it.
Yes.
It really highlights how much goes into creating those programs and those support systems. So it's not just, like, showing up and hoping for the best.
Right. It's very intentional.
There's a lot of thought that goes into it. Okay, so we've talked about inpatient rehab. We've talked about outpatient programs as another pathway to recovery. What about support groups? Because I think for some people, they might hear support group and think, like, oh, that's something you do after rehab.
Right.
Or, like, that's not really treatment. But it sounds like it's a lot more nuanced than that.
It is. Support groups can be an integral part of, any stage of recovery.
Okay.
Whether you're, just starting out or you've been in recovery for years,
Interesting.
they can be incredibly beneficial.
So it's not like a one and done, like, okay, I'm good now. I don't need this anymore. It's something that can be like an ongoing source of support.
Exactly. It's like this ongoing maintenance and growth opportunity, really.
Got it. I love that. Okay, so paint a picture for me. If someone's listening to this and they're like, okay, support group, what does that even look like? What does that actually entail?
Yeah, so a support group is basically just a gathering of people who share a common experience or struggle.
Okay.
And in this case, it would be addiction and recovery. And they come together, typically in person, sometimes virtually these days.
Sure.
And they share their experiences, they listen to each other,
Yeah.
and they offer each other support and encouragement.
So it's like a safe space to kind of process what you're going through.
Exactly. It's a judgment-free zone where you can be completely honest and authentic.
Right, because I imagine, again, going back to that theme of shame, that can be a big barrier for people, is feeling like they can't talk about this openly.
Absolutely. And that's one of the beautiful things about support groups is that it kind of breaks down those barriers because everyone there is in the same boat.
Right.
They get it. They've been there.
In there, yeah. Okay, so we've talked about inpatient, outpatient support groups. I think what I'm gathering from this conversation is that there really is no one-size-fits-all approach to addiction recovery.
Exactly. And that's such an important message to reiterate. Recovery is a journey, not a destination.
There you go, that phrase again. I love it.
Yeah.
But it's so true. And I think it's easy to get caught up in, like, okay, I need to follow these steps and then I'll be cured. But that's just not realistic.
It's not. And it's not helpful to think that way either, because then when we do experience those bumps in the road, which are inevitable,
Right.
it can feel like we failed.
Like it's over.
Exactly.
Yeah. No, I love that. Okay, so is there anything else about support groups that we should know or any other kind of pathways to recovery that we haven't touched on yet? Because I want to be sure we're giving people a really well-rounded view of what's out there.
Yeah, I think we've covered the main ones, but one thing I will say about support groups
Mhm.
is that sometimes people, they kind of shy away from them because they think like, oh, that's not for me, or they have this idea of like what a support group looks like, and it maybe doesn't feel appealing.
It feels very like Hallmark movie, you know?
Exactly. But the reality is support groups come in all shapes and sizes. There are groups that are, very structured and formal, and there are groups that are more casual and laid back.
Okay.
There are groups that are, specifically for certain demographics or experiences. So I always encourage people, like, if you're curious about support group, just do a little research, see what's out there. You might be surprised at what you find.
I love that. It's like finding your people. Right?
Exactly.
Like there's a place for everyone, which I love.
Mm.
Okay, so we've talked about the different pathways to recovery, the
Mhm.
resources that are out there. I'm curious, from your experience working in this field, what are some of the biggest misconceptions people have about addiction and recovery? Like, what are some things that you wish people understood better?
That's such a good question. I think one of the biggest misconceptions is that addiction is a choice.
Okay, yeah.
Like people who are struggling with addiction are just making bad decisions or lacking willpower.
Right, like they're choosing drugs over their family or their job or whatever it is.
Exactly. And that is so far from the truth. Addiction is a complex medical condition that affects the brain and changes behavior.
So it's literally changing the way that their brain is wired, which then affects their choices and their behaviors.
Exactly. It's not simply a matter of willpower.
Got it. So that's a huge one, I think, is shifting that perspective from blame and shame to understanding and compassion.
100%.
Because I think, unfortunately, there's still a lot of stigma around addiction.
A lot of stigma, yeah.
And so, to your point, like, if we can start to view it as a medical condition as opposed to a moral failing, I think that would go a long way in helping people get the support they need.
Absolutely.
Yeah. Okay, what else? What other misconceptions are out there?
Another big one is this idea that recovery is linear.
Okay.
That once you're in recovery, it's like everything's smooth sailing from there on out.
Right, like you're fixed.
Exactly. But the reality is recovery is a process.
It's a journey, not a destination.
There you go. You get it.
I've heard it once or twice.
And it's a process that's often marked by ups and downs.
Right.
There are going to be good days and bad days. There might be setbacks.
Totally.
And it's important to kind of normalize that and to not view those setbacks as failures.
Right. Because I think that's where the shame spiral comes back in, right? It's
Yeah.
like, oh, I messed up, so I'm a failure. I might as well just give up,
Exactly.
right? When really it's like, okay, what can I learn from this? How can I get back on track?
Exactly. It's an opportunity to learn and grow and adjust your approach if needed.
I love that. It's like, it's not a straight line. It's like this winding path
It's a winding path.
with lots of twists and turns, which makes it more interesting, I think.
It does. Makes it more interesting and more kind of your own in a way.
Yeah. And it makes sense, right? Because like we were saying, addiction changes the brain, so it's going to take time and effort and, maybe some course correction along the way to kind of undo those changes.
It's like any other skill that you're trying to learn or any other habit that you're trying to change.
It takes practice.
It takes practice and patience and persistence and,
Yeah.
support. It doesn't have to be done alone.
Speaking of support, I'm curious, for our listeners who are supporting loved ones who are going through this, what are some things they can do to be supportive and helpful? Because I imagine it's a really tough position to be in, watching someone you love struggle with addiction.
Yeah, it is incredibly difficult. And it's important to remember that Addiction, it affects not just the individual, but the entire family system.
Yeah, like a ripple effect.
Exactly.
Right.
So one of the most important things loved ones can do is to educate themselves about addiction.
Okay.
Understand the science behind it, understand the challenges of recovery, understand the resources that are available, because that knowledge can help to reduce stigma
Sure.
and it can foster empathy and understanding.
Right. Because if you don't understand it, it's easy to just write it off as, like, we'll just stop using.
Right. Exactly. And another key piece is setting healthy boundaries. And this can be really, really challenging,
Oh, yeah.
but it's so important because it's not about enabling the addiction,
Right.
but it's about providing support while also taking care of your own well-being.
So it's finding that balance between being there for them, but also not losing yourself in the process.
Exactly. It's like they say on airplanes, put your own oxygen mask on first before assisting others.
Right. Because you can't pour from an empty cup.
Exactly. And finally, just remember that recovery is a marathon, not a sprint.
It's a journey, not a destination.
There you go. You got it. So it takes time. It takes patience. And it takes, just unwavering love and support.
So much wisdom packed into those 3 pieces of advice.
Well, thank you.
I love it. Okay, as we start to wrap up this deep dive, is there one final thought you'd like to leave our listeners with? Something maybe we haven't touched on yet, or something you just really want to drive home?
Yes, absolutely. Whether you're personally navigating addiction and recovery, or you're supporting someone who is, please remember this. There is always hope. Recovery is possible. It's not always easy, and it can be messy and it can be challenging, but it's always, always worth it.
I love that.
And so don't give up on yourself. Don't be afraid to ask for help
Yes,
because there are people who care about you. There are people who want to see you succeed. And sometimes you just need a little help finding those people or letting them help you.
absolutely. We're not meant to go through this thing called life alone.
We are not. We
Yeah.
are wired for connection.
We are, yeah, which is beautiful and also sometimes really hard.
Yeah.
But yeah, I love that message. There's been such an incredible conversation. Thank you so much for sharing your expertise with us today, for really shedding light on this topic, because I think, there's so much nuance here and we only scratched the surface, but hopefully this gave our listeners a good foundation to kind of start from.
Yeah, absolutely. And if I can just leave your listeners with one kind of final thought,
Yes, please.
it's that no matter where you're at in your journey, whether you're just starting to explore recovery or you've been on this path for a while, or maybe you're supporting someone who is, remember that there's always hope and you don't have to do this alone.
Beautifully said. Couldn't have said it better myself. And to our listeners, thank you for joining us on this deep dive into the world of inpatient drug rehab. We'll see you next time for another deep dive into a topic that matters.